Okay, we'll get started. I'd like to welcome everyone. My name is Ken Roberts. I'm System Director of Marketing Communications and Community Relations here at Arnot Health. I'm joined today by my colleague Herb Alexander, who's Chief Diversity and Learning Officer and Chief Health Equity Officer at Cayuga Health. We are proud to host this second in a series of 3 Lunch and Learn sessions during Black History Month. In a few moments, Herb will share some background on the origins of Black History Month, as well as this collaborative effort between our 2 health systems. But first, I'd like to introduce today's presenter and my friend, Andrea Miles Ogunwumi. Andrea has distinguished herself as a professional and leader in the field of business management. She is a strategist in the development of programs, products, services, and concepts that provide powerful solutions to meet business and community needs, utilizing IT and human technologies to expand business and program outcomes. Currently, Andrea serves as Chief Executive Officer of the Economic Opportunity Program, or EOP, a $9 million 59-year-old community action agency serving Chemung and Schuyler counties. Andrea believes that learning is a lifelong process that must be managed individually and collectively. She received her bachelor's degree from the College of William and Mary, a Master of Science in Organizational Development with a focus in strategic planning and business management from the American University School of Public Affairs in Washington, D.C., and a doctorate in education from Grand Canyon University with a specialty in organizational leadership. Andrea's experience in both the profit and nonprofit sectors provides a unique and balanced perspective. Her industry experience with Corning Incorporated, the Equitable Life and Assurance Company, and the Xerox Corporation combines 25 years of capability in the areas of marketing, strategic planning, organizational development, human resources, diversity, training, and development. Andrea served for more than 20 years at the senior leadership level at those 3 corporations and received industry-wide recognition for groundbreaking e-commerce innovation and marketing achievement. Andrea also served for a decade as an adjunct professor at Elmira College, teaching graduate business management students how to make theory practical. She has lectured at several colleges nationally and internationally as visiting faculty, and her educational background and practical training add to her expertise and extensive work experience and portfolio solutions. Andrea received numerous awards and honors, including the Woman of the Year in 2006 and the Alpha Kappa Alpha Leadership Award. In 2012, she was awarded the Elmira College Graduate Excellence in Teaching Award. In 2014, the National Leaders Initiative Phenomenal Women Award. In 2019, the New York State Historic Preservation Award for the Libertad Elmira Project, which we'll talk a little bit more about later. And this year, the Black Community Honors Award. Today, in addition to leading EOP, Andrea serves as a private consultant to senior leaders of Fortune 500 corporations, colleges, universities, municipalities, and church dioceses. Andrea believes in principled living and leadership. She is committed to impact human, business, and social issues. Andrea's community involvement has included participation in the engineering board of the City College University, the Southern Tier Library District Board of Directors, and the Prevent Child Abuse, the Clemens Center for Performing Arts, and the Alternative School for Math and Science boards. Andrea was also appointed by former New York State Governor Cuomo to serve as a member of the New York State Community Action Advisory Council. In addition, she currently serves on the Excelis Blue Cross Blue Shield Regional Advisory Business Council, the President's Council of Elmira College, the IRES Foundation at the Rochester School in Nigeria, West Africa, and we are especially grateful for this, the Arnot Health Board of Directors. I don't think she sleeps. In conclusion, Andrea's direct and exacting approach supports people in the achievement of their desired bottom line results. As Andrea often says, success is a life commitment, change is the vehicle. Andrea, thank you for joining us today.
Thank you, Ken. Thank you, Herb. And thank you, everybody.
Okay. Now, after we hear from Herb, we'll watch a short video on the cell clinic at EOP, followed by some remarks from Andrea. You'll then have the opportunity to ask your questions during a Q&A session that Herb will moderate. So with that is the rundown of today's program. I ask that you mute your microphones if you haven't already, and I'll turn it over to Herb.
If you were in the last session with us, you would have heard a little bit about this, and it's just a backdrop on how we got to the okay. I think we got there. And so I was saying how we got to the backdrop of Black History Month and just the legacy behind it. And so we're just kind of walk through a little bit of that history, and then we'll switch into the video. So again, at any point in time, if you can't see my screen, just let me know. Okay, so what we'll go through again, the origins of Black History Month, the truth and the legacy of Blackness in America, which is super important as we frame the context of what we're going to talk about today. And then we'll just hear from Andrea and how this is happening right now in our own community. And so just to give some quick history on how we got here, which I think is a really amazing history, and folks often don't know this across the spectrum, no matter what background you come from, what culture you come from, is the origins of Black history. So Carter G. Woodson was he was actually the second person to graduate from Harvard behind W.E. Du Bois with this postgrad degree or doctorate. And a lot of his study was in history, specifically studying the intersections and the components of Black history as it is here in America and how that was influenced really prior to America. And during his studies, he really understood or found that it was important for all Americans, especially Black folks in America, to know the history and the impact. January record itself. Can is somebody off mute? Is that Dr. I don't know the last name, but if you could for us, I think it might be able to hear. Thank you so much. Okay. And so something he wanted to do was come up with a Black History Week. And so it was actually, the way he defined it was the association and the study for African American life and history. And that was back in 1926. And so as he developed this, he actually picked February, in the second week of February for this week, because it was the combination of both Frederick Douglass, who was an upstate pioneer for Black history and Black freedom, and Lincoln, and both of their birthdays was in the second week of February, so he chose that week. And so as the week developed, it turned into celebrations, history, education, and really just community time around the idea of Black legacy and Black history. And that event inspired schools and communities to look to celebrate and learn and to know more. And then over time, with the assistance of the civil rights movement, it went from a week to a month that folks began to celebrate. And this really started to pick up national attention outside of just the Black community, but really for all cultures, right? And so officially, President Gerald Ford recognized Black History Month in 1976. And that's how we got to have Black History Month as we know it today. It really was this grassroots movement and moment. And some of the things that we look to celebrate or recognize during this time are just, again, both the truth and accomplishments that are important for us to know. And so first, and I think this is some of the most fascinating history when it comes to Blackness and how things started to come about, was in January 1865, and this is after the Civil War and after the Emancipation Proclamation. General William Sherman gathered a group of the most prominent Black leaders. And at that time, those were like clergy people, pastors, elder folks, and wanted to say, what are the needs of Black folks post-slavery, right? From that conversation and from those, really, he was doing qualitative research at that time. That's really what that was, right? Him and Lincoln's cabinet developed Special Field Order 15. And what that was that granted land all the way from Charleston down through Florida for thousands, tens of thousands of Black families, right? Amounting to 400,000 acres, right? And so what that was doing was giving an economic base for Black folks here in America. Now, unfortunately, and that would have changed the tide of what we see for some of the economic gaps when it comes to wealth for Black folks and other folks in America. That isn't good now. That would have gave a completely different outlook on what we would have seen as the present day situation. But Lincoln was assassinated, as we all know, and insert Andrew Johnson, who unfortunately squelched Special Field Order 15. And so unfortunately, that didn't happen. And what had to build from that was that Black folks kind of finding their own way to develop an economic base, right? And so again, going to Black history, what are some things that happened? One of the most prominent stories, really in American history, especially when Black folks look at American history, is Black Wall Street, right? So in the early 1900s, so 40, 50, or 60 so years after the Emancipation Proclamation, in Tulsa, Oklahoma, a community of Black folks really developed some self-sustaining uh, economics or community economics, right? And they own things like bars, movies, restaurants, and even bus companies and planes, which is fascinating. So really started to develop economic base. Unfortunately, in 1921, the Tulsa Tribune posted what we now know was an inaccurate story about a Black man named Dick Rowland that painted him in a not great light in connection to one of his white counterparts and alleged some things that we now know didn't happen. And so post that, a mob of folks came in and burned down what was then known as Black Wall Street. And so burned down 36 blocks, that left 9,000 folks homeless, and unfortunately had 300 deaths and 800 injured. Despite that, though, this still remains really a prominent fact in history when you look at Black history, right? And all of the things that folks did. And then, even though Black Wall Street was destroyed, it kind of set the template for other folks to do similar things throughout history. And just the last couple of things before we switch over, get into the healthcare space, some truth and accomplishments that if you look at Black history, Henrietta Lacks. So in the 1950s, Henrietta Lacks became known as the mother of modern cancer research. And that's because she went to Johns Hopkins for at that time what was vaginal bleeding. Unfortunately, without her knowledge, a tumor or part of her cells were taken as a sample. And to many of the researchers' surprise, her cells were what they saw as immortal, meaning they always regenerated and did not die. And they were named HeLa cells. These HeLa cells were then patented and generated tens of millions of dollars for in research, really for cancer research. Unfortunately, up until recently, her family actually did not receive any compensation or recognition for her contributions to cancer research. But as of recently, that was settled, and more folks know about Henrietta Lacks nationally, which is great. But she is celebrated as one of the mothers of modern day cancer research. And then lastly, before we close out and pass it over to hear from the great things that Andrea is doing, is Dr. Daniel Hill Williams, who was a Black doctor who studied at Chicago Medical at a time where there weren't many Black doctors, right? So we're going to highlight that. So that might be something that seems more normal now, but that was a huge deal at that time. It still is at this time. But not just was he a Black doctor, he actually founded and opened the private hospital and training school for nurses. And that was the first training program with a racially integrated staff. So combining folks from all different backgrounds. And they performed and did great, right? And I guess the idea that when you do encourage diversity and equity, that it leads to great outcomes. And he actually was the first doctor alongside his racially integrated staff of nurses to perform a successful open heart surgery, which is a great piece of history. So why do we bring this up? To say that all of these things in history are shaping where we are now and where we're going to go. And it talks about the legacy of Black folks. So the things that we see here kind of have set the stage for work like myself and others, what we're going to hear from Andrea, and really what we look to continue to push forward as we carry the legacy of the folks who came before us. So what we're asking you all to do is today, if we can just continue our self-education on our history, because Black history is American history, right? It impacts and affects all of us. Recognize that there's current work happening, both at your organization and out of the community. And today we want to appreciate our board member, but also our community partner who's doing excellent work, and then just engage and ask questions as we go forward. And so with that, I'm going to pause here and pass it to Ken and Andrea as you get to hear more about what's happening.
Thank you.
Great. Thank you, Herb. Thank you, Ken. Says that I cannot share my, oh, we have a video. Okay.
Yeah, just got to play this video real quick, and it's about 3 minutes for everyone, and then we'll kick off your remarks.
Okay, great. Thank you.
Hey, Ken, you have to share your sound, I think, unless it's just me.
Economic Opportunity Program
Started.
and local providers are working to help you and your family take a step towards lifelong good health by improving access to health care. EOP offers a variety of different screening programs, all of which are free of charge.
One example is the lead screening program for children, where we are trying to help locate children who have high levels of lead.
Touching, swallowing, or breathing in lead can be detrimental, especially for children. Excellus and LECOM's med students aim for early intervention, helping those exposed to toxic substances.
The significant developmental delays that can happen when you have elevated lead levels in your bloodstream.
The effects of lead poisoning can be permanent, but you likely won't notice the signs of lead exposure until it's too late.
You won't necessarily see symptoms when the damage is happening, and it won't be until the damage has occurred that you kind of pick up on the fact that this might be going on if you don't screen.
Since the start of the clinic,
we've tested 352 kids for lead, and I think it's really amazing to be able to give the community that power to take control of their health.
And among those 352 was Tanisha Logan Lattermore's family.
I had my whole family tested, or all the ones that I could get here. I had, I believe, 10 of us.
The results showed some unexpected news.
I found that one of my sons has a high level of lead, and I had no idea.
Tanisha's son is already battling health issues.
He has sickle beta plus thalassemia, and so we have to have him go back and forth to specialists in Rochester and Syracuse. And I did not know, though. I had no idea that his lead level was high.
With those test results, his providers will be able to consider other factors in his treatment.
At least that information can help see if there was a correlation. Is there something I should be worried about? Is it something that is more prevalent with him, obviously, versus my other children?
On the day of testing, Tanisha watched her children go in one by one, anxious for the other results.
Waited with bated breath for all of the other children to be tested, and he was the only one with a high lead level.
Without lead testing, Tanisha never would have learned valuable information about her family's health.
Please come out, take that time, have your children and yourself tested.
For more information, to have questions answered, or to make an appointment, call 607-734-6174. For Arnot Health, I'm Lexi Cutmore.
Okay, great. Thank you, Ken. Can everyone see the screen? Okay, excellent. We want to talk about, of course, the Cell Clinic and the partnership, the community health partnership that we have with Arnot Health. But we also want to, and the focus is Black History Month. And so you might say, well, how does this connect? And why do we even celebrate Black History Month? I think it's important for us to honor our past by helping secure a better future. So already you are engaged and working on the better future with us in the community. And so that's an important piece. We're part of a network of 1,100 other community action agencies. So for us, we are very intentional in terms of what we focus on. We cover Chemung and Schuyler counties, but in terms of our partnership with Arnot Health, Excellus, LECOM, and even Common Ground Health, we have been able to focus that in Chemung County and starting to branch out and do a little bit in Schuyler County. But it's so important because when you think about who we're focusing on, who we're serving, individuals who were truly access to healthcare is an issue, marginalized populations of people who are poor. And when we began to look at who are even the categories of people in who we work and serve and focus on, many times they are individuals who are African American or other ethnic minorities. So again, the work that we're focusing on, we're intentional about out that work, and we appreciate the partnership that we have to do that with Arnot Health and others. We focus on food security, child and youth care, and housing security. Those are our key strategic areas of focus. And you may say, well, wow, they look familiar because those are some of the issues that we talk about in terms of the social determinants of health. And so again, it is all connected, it's all linked together. And when we began to say, well, okay, how are we doing in those areas? We are really hitting a lot of key goals in our focus on access to healthcare. You heard in the overview, more than 700 lead and blood pressure screenings have been able to be provided to our community because of the partnership. We talk about the ACEL clinic, and that clinic actually represents a partnership and a collaboration with Arnot Health, Chemung County Public Health, EOP, and LECOM. So that's where the acronym ACEL comes from. But we have been able to provide that support. We have other areas of focus with EOP. We're one of the largest providers of childcare services with Head Start, birth to 5. And so those are some of the areas that we focus on in providing those children with lead tests, because again, an important population. And as you heard, even in the testimonial from the parent, because we were able to get them tested early, we can now track them, do follow-up, and ensure that they have the supports needed. So these are just some key areas, and we'll talk a little bit more about them, but we have been able to provide blood pressure screenings as well. 363 of them that were completed with children and also adults. So the focus becomes one of preventive screenings, getting there early, as you heard even from the parent in their testimonial, being aware early of this situation with the high lead levels allows them to then track and have a higher impact. If you were here in our earlier session last week with Talima Aaron and the John Jones Museum, we talked about the history of the powerful history of John Jones and his contribution to the community, and even the fact that in celebration of his contributions to our community, there was a housing complex named after him called Jones Court. Many may be familiar with that. But Jones Court fell into blight, and we found that it really was a structure that needed to be rehabilitated. So some of our work in partnership with the Facino Group is we work together with them, as well as many in the community, to move forward and to actually do renovation. So it's now called Libertad Elmira. And in addressing housing insecurity, we now have homeless veterans who are provided for and taken care of. They're no longer homeless because of our help in the initiatives. We work with Arnot Health and your nurses who actually went into the facility and have gone and they've done blood pressure screenings, they've done other health types of screenings in that environment, not just serving the homeless veterans, but all 71 other residents who are there as well. During COVID, your teams even supported in providing some vaccination clinics. So again, your impact in the community is great. And sometimes we don't know our history. We don't know how we've contributed to it one way or the other. But it's an important thing for you to know, even in that environment, from our history of the John Jones, the Jones Court, we were able to rehabilitate it and also work so that we are helping to secure a better future. And I think that's what the essence even of Black history is about. Knowing our history, but then identifying areas of action so we can move forward. In terms of some of the other work we do, even with the ACEL clinic, just to give you a sense of the timeline, we actually cut the ribbon November 2021 at the ACEL clinic. We were supported with very generous partnership through Excellus Blue Cross and Blue Shield. In May of 2022, we actually opened the clinic. And so you can note that we were able to move through this even despite COVID and some of those delays. And then we began to also add in the blood pressure testing, and that is pediatric testing as well as for adults. We decided that since the parents were bringing the children for the lead testing, we might as well use it as an opportunity to serve the entire population. So this just shows Wednesday, November the 3rd, we cut the ribbon, and you probably see some familiar faces here. There's Ken, and we came together as community partners and hosted a press event to share with the community that this is a partnership where we're committed, not just to understanding the data and the issues of health, whether it's diabetes, COPD, lead, but coming forward with a plan of action, an intentional plan of action to change possible outcomes. Some of our community partners, Dr. Terry, Excelis representatives, and our LECOM partners have helped to manage, and your lab oversees to ensure that we are doing everything in a quality controlled way. February of 2023, we host and continue to host more education and communication, because we don't want to make the assumption that people really understand even about COVID, what's happening. And now we have RSV, and now we have high levels of influenza. And working with the community, our commitment is to bring the programs and services to the community. And you've partnered with us in being flexible in that way. We also had our first anniversary, May of 2023. And then we also began to add, because the project is phased. So we now have added in SNAP education workshops, again, addressing access to quality health care, housing security, food security, and of course, focusing on our population of children and youth. For us, there's a lot of data out there that discusses the link between the social determinants of health. And you have your own team who works with patients to find out what are all the needs that they have. And so what we've learned at our location and through EOP is that we don't want to make assumptions that as we work with children in the child care area, that their family has food or they have access to housing. You know, we don't want to make those assumptions, because they're marginalized individuals in our community who don't have access to appropriate health care. So we want to ensure that we ask those questions and then we engage to provide solutions. We view ourselves as solutionists. We are always one with the data, always reviewing and doing community assessments, trying to determine what's important. But what we do with the data is we develop action plans, because we are a community action agency. So if there is a problem, we work with you in partnership and others to come up with viable solutions. So in June of just last year, we began offering evening hours, because we recognized having the clinic open only 2 to 4 didn't address some parents or guardians who might need to come after work. So we actually now have the first Thursday of every month, we have evening hours from 5 to 7 o'clock. And we found those evening hours, our attendance rates are 50 to 60%. So we have seen a great increase there. We also were involved in some outreach with you at Arnot Health, and we thank you for inviting us to be a part of your wellness fair. And we have started to continue to work to ensure that we can expand the food security component with a partnership that you helped expose us to and make us aware of, the food prescription referral program with SNAP Ed. So we are very excited about this partnership and the work that we've been able to do. In November, we received the Health Equity Award, the Innovation Award from Excelis Blue Cross Blue Shield. And in December, the Excel Clinic did its 700th screening. And we are very pleased to say that our work isn't finished, it's not done. And we want to continue in our partnership with you and others to ensure that everyone has access to quality health care. So our 700th screening was this family that you heard the testimonial from. And so mom was the 700th, and I think the children were the next 10. So we were able to support this family. What we find is when we have an elevated level, high lead level, because of our partnership with Arnot Health, our partnership with Eastside Clinic, we're able, if they don't have a pediatrician or a family doctor, we're able to, within 24 to 48 hours, to get them to a pediatrician so that the next levels of testing can occur. So primarily when we just look at the lead component of this, because you heard in the report that, lead, high levels of lead, if they are recognized early enough, we can really prevent other ongoing issues, developmental issues. There are even some studies that talk, there may be a connection between lead and even later violence. So what's so key is to ensure when we look at the data, African Americans, other ethnic minorities have higher levels of lead, often because of their housing where they're living, the high levels of lead, even housing stock that hasn't been renovated. So part of our partnership is to work with people in all of those components to begin to see if we can make a positive impact. So of those that we have tested for lead, about 350 we've tested, 4.9 have had elevated lead levels. But we can report really clearly that those individuals have now had follow-up care and are working with a pediatrician, working with intervention so that we can get ahead of and stay ahead of any issues. And I think you heard that in the testimonial. So in terms of our focus, what are we doing next? Well, as Ken says, we don't really sleep much at EOP, and so many of you don't either. But we already have been working together with Tina Bird and her team and working on what we would do as we continue to address the key areas of food security and nutrition and healthy, active lifestyles. So the meal plan was developed, mindful eating and active lifestyles. And we piloted last year. And so we've received additional funding from Excellus Blue Cross and Blue Shield. And so that program is a nutrition and physical education program for early childhood education classrooms. And that's facilitated by you, Arnot Health, co-sponsored by Excellus, and working with EOP because we have our children in our early Head Start program who are involved in the meal activities. So we will be moving forward this spring and fall in all of our Head Start classrooms. More than 200, 300 children will be engaged in this program. You might say, what can I do? How can I engage? What can I do to help the community and help others secure a better future? Well, we have many programs and services in the areas: access to health care, food security, housing security, and child and youth care. So we want to invite you because I think information is power. And I really appreciate the invitation and also the vision and development even of this Black History Month series. And I hope that, as you continue to move forward through this month, that this isn't the end, this is just the beginning. So we are hosting our annual meeting. We're calling it an open door. Our door is always open to the community that we serve, serving more than 5,000 people annually. We are hosting an activity where we will highlight our programs and services, focusing on those 4 key strategic areas. Our staff is available, so visit us on February the 27th, that's actually next Tuesday, from 10 to 3 as we host more. As we go forward, other activities, ways that we can partner. We can partner at Juneteenth, which we have in the past. We invite you to participate because that's another time and timeline in Black history, African American history, where we have a cultural celebration, which is connected with very important history in terms of freedom for those who were enslaved. So there are lots of chances, lots of opportunities. Also to volunteer. In many ways to serve on boards, whether it's at the John Jones Museum or involved in activities here at EOP. There's so many ways that we can continue to work together collectively to value our history, and also value the history of everyone. So any questions? I think I've stayed within my timeline.
Yeah, we have a couple of questions that came to
Great.
me. This microphone here. Oh, that's can't put them in there. Okay. Well, first, thank you. And for all the work you are doing. And yeah, sleep doesn't seem to be a thing for you and the team, but we appreciate the work and efforts you are putting in. And
Thanks.
so, yeah, absolutely. So are you okay if I share a couple of the questions that I got here in
Oh,
the chat?
yeah, that's great. Thank you.
First, someone just asked, what is Head Start? You mentioned Head Start a couple of times, and what's like the impact of Head Start?
Oh, great. Thank you for that question. Our Head Start program is our largest program. And so we actually, in terms of programs and services for children as young as 18 months to 5 years old, we provide early childhood development, classroom settings. We also provide all of the needs that they have in terms of dental screening, vision screening, hearing screening. So our partnership focuses with the parent and the children. So they actually come to school here with us. And we often say we will take them at the very beginning and work with them and work with their parents as well to ensure that they have everything that they need. And so all aspects of early childhood development we focus on with the children, and also making sure that they are ready for school, because that school readiness is key. The parent is the first teacher and a key teacher, and depending on what they might be faced with, we're there also to support with family advocates and case managers to help the parents to ensure that they have the supports that they need. We have parenting and engagement classes that actually teach the parents and advise them on what are some of the principles of being a good parent. I mean, many would say, hey, I didn't have that when I was bringing my child up. So that kind of support is key. On average, most school districts spend annually, maybe close to about $9,000 per student when you work at it. We spend about 12 to ensure that individuals, marginalized individuals who may not have access to all the things that others may have, that they have the supports that they need. So we have a very strong team. We feed them, again, addressing food security. We feed them a healthy breakfast, lunch, and snack. So annually, we prepare about 90,000 meals for our Head Start population. And then we provide an after-school program for children who are ages 5 to 12. It's called Centers of Excellence. And we also host the Ernie Davis Community Center. Many people in the community have been involved there. So that adds on annually about 100,000 meals we are providing to the community, again, to address food security. If you think of it in terms of Maslow's hierarchy, and everybody, I'm not going to give anybody a test. I am an educator, but I'm not going to give any tests today. But if you think of Maslow's hierarchy, that basic triangle, bottom level, food, clothing, shelter. So those are the needs that people have. And so we provide those needs so that they will have a visible and achievable playing field, because you can't expect the child to learn or to really move to that higher level of being educated or acclimated if they're hungry, or if they're living in a place where there's carbon monoxide poisoning or high levels of lead. So we work on the basic foundation to ensure that they then, with their families, can move forward. Thank you for that question.
Yeah, thank you for that.
And the other thing, we're looking for volunteers. Ken has been phenomenal. Some of the kids and the staff asked for Mr. Ken to come back. If you have 15 minutes and you want to have a great stress release, come to our classrooms. Kids love to have stories. They love to have a story time with you. And it only takes about 15 minutes, Ken? It's not a long commitment. So that would be a great thing.
It's usually the best part of your day when you do that.
It helps me stay focused, as to why I do what I do.
Good, appreciate that. And yeah, get to know Ken is out there. I mean, who wouldn't love to have Ken out there? Nobody answered that out loud, but who wouldn't love to have Ken there? It's great. Okay, so and that actually goes into one of the other questions that we have, which was how can folks get involved, or is there a link to the annual meeting or other resources? So maybe we could put that in towards the end to get folks to be able to sign up and collaborate.
Oh, that'd be great. Yeah. So primarily for the annual meeting, you have to come to the Ernie Davis Community Center. Most people in the community know where that is, but that's 250 5th Street. So you have to physically come last year we did hybrid, the year before we did virtual meeting, but we're inviting you to experience physically our open door. So that is something that we're hosting and available to have. And also, if you would like to volunteer, and please consider that. Just give us a call. Feel free to give us a call at 607-73. I never call myself 734-6174 extension 206, or just give us a call. We will engage you because we have lots of ways. Some individuals, we have about 350 volunteers. Some volunteer one event or activity a year, and others volunteer in an ongoing way. Just depends on your availability and what works for you.
Great. Thank you for sharing that. And I see Kim put the link.
Thank you. Thanks, Ken.
Great. Okay. And we have 3 more questions and we got about 10 minutes or so. So I'll just go through those. And one goes to what you were just saying about the different needs. So you mentioned food and housing and other things. And the person asked, is there a main social need that people have in the community? Or another way to ask is there a social need that you see kind of rises above the other, or are they all just interconnected?
Well, I think that's a great question. Thank you for asking it. And I think they're interconnected, because when you look at the social determinants of health and the things that impact people's health, you're seeing that with your own patients. You're seeing that connection with, physical health, mental health, emotional health, food, housing. We've had so many sessions and discussions where persons showing up in the emergency room in an ongoing way. And you are, of course, helping and focusing on their medical need, but only later to find out that, they're going back to a home or an apartment where there are issues in the physical environment, whether it's, poor ventilation or mold in the environment. So those are real connective pieces. You can't just focus on one. But in our area, what are some of the high trends? We're seeing, and this is a national challenge as well, we're seeing an increase in homelessness, and that is impacted by several variables. There are people who still actually have not recovered from COVID from an economic perspective. There are many people who lost jobs or they lost hours in their wages. So there are new definitions of homelessness. They're not the old images that we may have thought about in the past, but people who are couch surfing, people who are, don't have a permanent address anymore. We have a lot of children who are falling in that category. In the state of New York, as a result of COVID, we've had more than 325,000 children who have now moved into the ranks of poverty. So the impact of that is long lasting. We also are seeing more homeless people come to our county and other counties as we have some sanctuary connections as well. So we are finding that we are serving people from other counties because we ask, because daily we have breakfast, which is 8 to 10, it's a grab and go breakfast, and dinner from 4 to 6, grab and go dinner. We are seeing large numbers of people, lines of people coming for the grab bag food. And so we always ask, where are you from? And, we engage them. So we're finding that they're even coming in from other counties and other places. So we are seeing more and more. And so I think that's one issue that's occurring. We have more and more children with disabilities. And I say they're differently abled. So again, when we talk about diversity, equity, and inclusion, to be able to address those needs and the concerns that are there, and even to learn how we need to learn how to work with individuals who are differently able. And that's truly a diversity, equity, and inclusion piece. Additionally, what we're seeing is when you think about the food security piece, it's not just children, it's not just homeless. We're seeing the elderly be impacted greatly in that way. We still have some elderly participants who haven't come out in a regular way because of COVID, and now RSV and influenza. So there are many who, really are not getting enough food or not getting nutritious food. So we've been working with Office of the Aging and other groups to try to ensure that we can get food out to them. We actually deliver to even some of our children and their parents more than 230 meals and backpacks of food annually. We take it out to them because we do not prescribe, like if we build it, they will come. So we are very outreach oriented and in-reach oriented. And our partnership with you through the Acel Clinic, I think, is a great example of that, where you were willing to come into the community, set up shop in collaboration with LECOM, to bring this service to an environment that people come here daily. They're very comfortable to come here. It's a trusted environment. They're dropping their kids off for Head Start class anyway. So you were able to be innovative and creative to provide the service and bring it to the place where the people are. So thank you for that.
Thank you. And we only have a couple more minutes here, and we have a few more questions. So I'm just gonna I'll just ask this last question, and we can see if we can follow up on ones that I didn't get to. And it's so as folks think about the past works that have gone on to like the legacy of Black history and some of the things we heard about earlier today, how do folks take that information and honor the past by having action now to impact a better future? What are ways that you would advise folks to be involved today that leverages the legacy of what we've seen from folks in the past?
Thank you, Herb, for that question. It's a very good question. I think, one, we have to know the past. So I think this education component is so key. Knowing and understanding the past, and even if it's the past of a different group or category that you may not belong to or have any connection, to just have that willingness and that curiosity to learn. To whether that's to read a book, whether that's to talk with someone, to attend even a session like this. I think that's one way that we can honor the past. And then once we gain that information, that understanding, and so that we can help, because we do have a moral imperative to help secure a better future for all people. And so I think that we hold that as an inalienable right in this country and hopefully in the world, that everyone should have access to quality health care, food, housing, and also to take care of our children who just, are not our future, they're part of our present. So I think that we can volunteer, we can write checks, we can donate, we can gain information. But even in gaining that information, it's not just, oh, let me, say I've heard this or I've learned this, but I have to take action. We're a community action agency. And so that's in our vision, that's in our mission, and we have to work and make that commitment. So whether that's in recruitment plans and strategies, whether that's in promotion plans and strategies, whether that's in outreach, and ensuring that more people have access to the information, with health information and other services. If we each take that on, not just that that's something that Ken and his department takes care of, or EOP does that kind of work, if we all take that on as a community, we can ensure that we are able to co-create that better future and that future that works for everyone. And so I think that's our call to action. And I even received a call to action in attending last week's session with Talima Aaron and John Jones. I'm gonna go see the statue, the John Jones statue, when that comes. And so hopefully even today you've heard something that will just trigger that for you, because we all can make a difference. Big oaks from little acorns grow.
Thank you so much. And I think there's probably not better words to end on. So we appreciate you giving us that call to action and for being here and just all the amazing work that you continue to do to impact the people in the community. So thank you. And with that, Ken, I'll turn it over to you to close us out.
Thank you, Herb. And thanks again, Andrea, for that great presentation and for joining us today and last week as well. Just remind everyone that's on the call, we have another session next Tuesday at noon. Herb, do you want to tell us who the presenters will be?
Yeah, so we have two people who are located in the Tompkins County area. Tali Mugambi, who is with the OAR or Reentry Program, helping folks who are formerly incarcerated find meaningful work. And then also Krista, her last Nunez, who's actually with the Learning Farm, helping to going back to the idea of food security and fresh foods for folks who don't have access. And so we'll get that information out to Ken, and Ken, you can get it out to folks who would like to join us for that session as well.
Great. Thanks, Herb, and thanks everyone for joining us, and hopefully you'll be able to join us next week. I will have this information for Arnot people, and I'll send this to Herb for the Cayuga folks. Have this presentation posted on our intranet. So if you missed part of it or want to go back to it, you can do that. So thanks again for participating, and have a great rest of the day.
Thanks. Bye-bye.
Thank you.
Thank you.